I had two clients come in last week and they both had the exact same thing. Chronic tightness and pain on this upper part of the hamstring that just would not go away. One is a dancer and one is a serious mountain biker. What they have in common is they both require explosive use of their hamstrings and glutes. So they had to take time off of their sport and they've been popped and adjusted and ultrasound and electrical stimmed and grass-stinned and foam rolled and everything you can think of, and then it feels better. And then they go back to their sport and guess what? The pain comes back and they're just like completely shocked. But in reality, there's probably a really pretty good reason. Hey everyone, welcome to the channel. Ed DeBoo, physical therapist from Integrated Physical Therapy in Bellingham, Washington. One of the first things I do when I see a patient with chronic hamstring pain and tightness that is not going away and they have an explosive sport like jumping during dancing or mountain biking, I always check to see if they have weakness in the glutes, or basically the hip musculature, and I'll tell you why. The glutes and the hamstrings tend to work together to perform explosive movements. In the presence of weakness of the hip, but yet we still demand the activity, guess what's going to have to work overtime? The hamstring. So who starts to get sore, painful, and tight? The hamstring. So yes, part of the treatment is first aid for the hamstring, but then you can see why rest alone isn't going to help it, because you rest it, hamstring heals up, you go back to your sport, glutes weak or the hip is weak, the capacity of the glutes met, next thing you know the hamstring's working overtime and you have pain. So I'm going to show you 3 different ways in which you can test the endurance and strength of your hip. 2 lying down, 1 standing up. We're going to test the glute strength lying down 2 different ways. The first one is just going to be a single leg bridge. In this situation, I'm going to test the strength of my left hip first. I'm going to bring it in close to my bottom, extend my other leg, scapula in the back pocket, engage my core, and then I'm going to come up and hold and back down nice and slow. And I'm going to get an idea of how many of these I can do until I start to fatigue. Now, if you're pretty strong and this just gets easy, imagine putting a little weight right here, right at your waist, and then coming up and back down again. But the idea is we're just trying to check the endurance of the muscle, compare it from side to side. The second exercise is like a clamshell, but you're going to need a TheraBand, and you're going to put it around your legs. Turn onto your side, and you're going to bend your knees about 90 degrees. Your feet are going to touch, and then you're going to pull up and back down slow. Pull up and back down slow. Once again, I'm going to check the endurance on this side just to see how many repetitions I can do until this side starts to fatigue, and then I'm going to compare it to my other side. If I find a weakness on the affected side, then that could be a big part of my hamstring issue. For the standing up test, I want you to visualize speed skaters. And I'll show this from a couple different angles. But the idea is that we're testing the endurance of that glute, but while we're weight bearing this time. So what you'll do is you're going to do a little bit of a hip hinge first. So what that means is I have a small hollow in my back and I'm driving my hips back. Now the idea is I want you to have the weight a little bit back towards your heel. And then I'm going to put all my weight on my left leg, and then I'm going to adjust my balance until I can feel that glute activate. If I'm up too high, I'm going to feel more quadded knee. So really stick that butt out until I can feel like right there I can feel my glute activated. Now what I'm going to do is I'm going to squeeze that glute nice and tight, and I'm going to take my opposite leg and I'm just going to tap it. Left glute's activated, and then I'm going to tap. And I'm going to count to see how many times I can tap until this leg starts to fatigue. And then what I'm going to do is I'm going to compare it to the affected side to get an idea of the kind of strength. Normally on the side that we have the chronic hamstring pain, there's almost always an associated glute weakness. Now we have to address the chronically tight and sore hamstring. If it's been with you long enough, there's probably a good amount of scar tissue in that area, and it could actually be affecting the way that nerve, that sciatic nerve kind of glides. So I'm going to show you a couple different ways in which I try to kind of get a glide or a stretch, a neurodynamic stretch with my clients. And you can use whichever one you want to. The idea with that is, once again, we're going to compare the affected side to the unaffected side. This is different from a static stretch because what I'm looking for is to see if there is any scarring or any adhesions of that nerve glide that's also affecting my ability to heal that hamstring. The first one we're going to do, I'm just going to demonstrate it here on my left leg. So what you'll do first is you're going to pull your left foot up into dorsiflexion. Your hands go behind your back, and then you're going to slouch and bring your chin to your chest. You've taken up all the slack posteriorly, and then you're going to bring your leg up as far as you can, pause, and back down again. Now it's normal to feel a hamstring stretch when you get up to the top, but once again, you're going to compare the affected side to the unaffected side. You might get a little tingling with this, not to worry about it. The idea is that we're just trying to restore the flexibility of the hamstring and also glide that nerve. The second way I want you to check, you're going to come back up and sit in neutral. Also keep your foot pulled up, but this time as you extend it, you're just going to look up to the ceiling and then back to neutral. Remember to coordinate the motion. So as your leg hits the peak, you're also looking into peak extension. And you'll do both of these and you're going to find out which one feels like it gives you the best bang for your buck. And then what I would do with this is, it's about 3 sets of 10, working on it a couple times a day. So remember, if you have chronic hamstring pain and tightness, especially with activity, leave the hamstring alone for a little bit and check the hip on that same side. Chances are there's going to be some weakness there. So your first goal is to increase the strength of that hip. Otherwise, the moment you go back to your dynamic ballistic activities, the pain's going to come back in the hamstring because it's being overworked. The capacity of the hip, of the muscle of the hip, is already done. So it's important to improve the capacity of the muscle by getting it stronger. So work on hip strengthening exercises as well as neurodynamic glides of that hamstring, just in case there's any restrictions or scarring that's adhering the sciatic nerve and not letting that dural or that nerve glide like it should. All right guys, if you haven't subscribed to the channel yet, now would be a great time to do it. Give the video a thumbs up if you feel like it helped you, and turn on your notifications so you never miss another one of my videos. All right, thank you very much. We'll see you next time.